Mr. President, very shortly, the Senate is going to take two votes on the President's nominees. The first is to confirm Jerome Powell as the next Fed chair. Once that vote wraps up, the Senate will vote on whether to begin debate on the nomination of Alex Azar to be Secretary of Health and Human Services. This is one of the key roles in our entire federal government in caring for America's sick and vulnerable. Let me begin by saying that Mr. Azar does not come with the staggering ethical challenges of his predecessor, the first Trump HHS nominee, Tom Price. Here is my concern. Mr. Azar's nomination is a clear symbol of the President's broken promises on prescription drugs and pledge to secure better and more affordable health care for all Americans. At the outset of my remarks, I'm going to start with the issue of skyrocketing prescription drug prices that now clobber millions of Americans at pharmacy windows across America. It is one thing for a presidential candidate to have claimed that he would just be too busy working to have time to golf and then spend almost 1 out of 3 days in office golfing. It's another thing altogether to promise cheaper prescription drugs to sick and vulnerable Americans who empty their pockets to pay for their medications only to abandon them completely once you are in office. Now, it was barely a year ago that Donald Trump stood before our country and said prescription hiking drug companies were getting, quote, away with murder. Mr. President, those were his words, not mine, not somebody in the news media. The President said the drug companies were, quote, getting away with murder. Now he's nominated Alex Azar, a drug company executive with a documented history of raising drug prices, to lead the Department of Health and Human Services. From 2012 until last year, Mr. Azar was the head of Eli Lilly's American subsidiary. That's Lilly USA. And he chaired the U.S. Pricing, Reimbursement, and Access Steering Committee, which gave him a major role over drug price increases for every product Lilly marketed across the country. On Mr. Azar's watch, the price of Forteo, a Lilly drug used to treat osteoporosis, more than doubled. The price of Effient, a Lilly drug used to treat heart disease, more than doubled. The price of Strattera, a Lilly drug used to treat ADHD, more than doubled. The price of Humalog, a Lilly drug used to treat diabetes, more than doubled. And these are only a few of the drugs that were under Mr. Azar's purview. Mr. Azar told the Senate Finance Committee that he had never, not even one time, signed off on a decrease in the price of a medicine. And when asked about that statement in his confirmation hearing, Mr. Azar was quick to say, "That's just the way the system works." But he didn't give us any concrete examples of how he'd buck that system if he became the head of the Department of Health and Human Services. Seems to me, given the fact that he was asked questions about what concrete ideas he had for reforming the system and carrying out the president's promises to hold down prescription drug prices, he came up empty, and I guess that says he'd fit right in with the Trump administration on prescription drug practices. In its first year, the Trump administration has made exactly no progress when it comes to tackling these skyrocketing pharmaceutical prices. They don't have any executive orders that have any teeth in them. Don't seem to be any new initiatives at all. No new legislation has come from the department or the White House. Perhaps, in my view, that's because the administration seems to be busy on other fronts, like taking health care away from those who need it, people who can least afford to have their bills climbing upward because of a decision made by a bureaucracy here in the nation's capital. Mr. President, this nomination, as you're going to hear senators discuss tomorrow, is about more than just the administration's failure on prescription drugs. It is, in effect, a proxy on an entire health care agenda. This is really a referendum on a health care policy from this administration that I think is an abject failure. It's a year in now, and the administration's track record on health care is pretty clear. New data came out a few days ago showing that the number of Americans with health insurance dropped by more than 3 million people. That means 3 million Americans are a sudden illness or injury away from the nightmare of personal bankruptcy, having to sell their home or their car or empty a retirement account to escape from under that mountain of medical bills. And two, a very substantial part of that problem stems from the administration's sabotage of the Affordable Care Act. The administration cut the open enrollment period in half. That meant that anybody who clicked onto the internet hoping to sign up this month has found out they're just too late. They slashed advertising budgets that help reach the younger and healthier customer that makes the private health insurance market affordable. And they made it harder for those having difficulty signing up for coverage to get a little bit of help in person. This agenda, this sabotage agenda, in my view, is an attack on the kind of health insurance this administration says it's for. They say they're for a private health insurance market, but the fact is, what they've been doing is undermining the private health insurance market as part of their effort to undermine the Affordable Care Act. So this policy, perpetrated by a party and the president who profess to want to run this country like a business, certainly doesn't reflect the kind of sound business practices we see from business leaders in my home state of Oregon. If that wasn't harmful enough, the administration also is allowing fraudsters to once again sell junk coverage insurance policies that aren't worth the paper they're printed on. A major part of the Affordable Care Act was laying down basic consumer protections for the private market. It was all about saying that Americans would no longer get stuck with junk insurance that turned out to be worthless when they actually suffered an injury or came down with an illness. Mr. President, I can't tell you what a step backward it is to see the sale of these junk insurance policies. Years ago, when I was director of the Gray Panthers, it was common to see older people buy 15 or 20 private health insurance policies to supplement their Medicare. And they weren't worth the paper they were written on. They were junk. And finally, we got that changed. We passed a law with teeth to change it. But now the Trump administration has, with respect to the private market, the Affordable Care Act, decided let's turn back the clock and bring back junk insurance in the private insurance marketplace. So instead of working on a bipartisan basis to make the private health insurance market more affordable and competitive, the Trump administration has sabotaged those markets, hiking the number of Americans without coverage and sticking a whole lot of Americans with junk coverage that, in my view, is virtually guaranteed to fail them when they are most in need. The biggest threat their strategy poses on a basic level is it wipes out the ironclad guarantee of protection for Americans with pre-existing conditions. Guarantee of access to health care isn't worth much if you can't afford it, and the Trump administration is doing a bang-up job of making health care unaffordable for those with pre-existing conditions. The Trump administration has also undermined years of progress with respect to women's health. They attacked a rule that says women have to be guaranteed no-cost access to contraception, one of the most popular health care rules in recent memory. Fortunately, the administration's action on that issue has been held up in the courts, but that is only one part of the anti-women's health agenda that plays out now. Just last week, the Trump administration overturned longstanding protections dealing with states and family planning providers. This, in my view, is an attack both on a woman's right to see the provider of their choosing and Planned Parenthood. The administration is also broadening the exceptions that give employers and universities say over what kind of health care women can access. Here's how Mr. Azar described his perspective on that issue when he went before the Health Committee. He said, and I quote, "We have to balance, of course, a woman's choice of insurance that she would want with the conscience of employers and others." Mr. President, we don't have to do that. A woman's choice of health care is her choice and nobody else's. The care she has access to and receives is not up to her employer, it's not up to a university, it's up to that woman and her physician. And now the administration is even going after protections for LGBTQ Americans. Bottom line, the administration is doing a lot more to protect the perpetrators of discrimination than the victims. Health care is a right in America, but discrimination is not. The way Mr. Azar describes the position he's nominated to fill, it sounds like he understands it. He said in his confirmation hearing, "If I get this job, my job is to enhance and protect the health and well-being of all Americans." But he is not committed to reversing these kind of anti-discriminatory practices I've just described. When I heard Mr. Azar say it'd be his job to enhance and protect the health and well-being of all Americans, I couldn't help but think back to the first nomination hearing the Finance Committee had for a Trump HHS nominee. Back then, Tom Price told the committee it would be his job at the department just to administer the law passed by Congress. He'd be out of the legislative business. Once he got the job, he broke his word, and that's been the norm for the department over the year. The Congress has every reason to believe that's going to continue, regardless of the talking points Mr. Azar and administration officials use. Finally, Mr. President, I want to discuss Medicaid. Just in the last few weeks, the administration has begun giving states a green light to slap new and punitive requirements and other limits on Americans covered by state Medicaid programs. My bottom line is Medicaid's a health care program. The vast majority of those who count on Medicaid either already have a job or unable to work due to old age and infirmity. And we shouldn't be trying to make life harder for those folks. The action by the Centers for Medicare and Medicaid Services goes after people who are just trying to get by. It's a decision by bureaucrats in Washington going after Americans who walk an economic tightrope, who might just be trying to take care of kids or elderly parents or struggling with a chronic condition. This looks on Medicaid like yet another ideologically motivated attack on a program that covers Americans, vulnerable Americans of all generations, from newborn infants to 2 out of 3 seniors. The Trump administration is giving states permission to attack it. Mr. President, I would ask unanimous consent for 2 additional minutes.
Without objection.
Mr. President, in a short while, the Senate will have a cloture vote on Mr. Azar's nomination to run the Health and Human Services Department. But the debate will be about a lot more than that. It's a question of whether the Trump administration should be allowed to take this country backward on health, to discriminate against Americans. It's a question of whether the attacks on Medicaid should continue and whether this administration is going to be held accountable for its broken promises on lower drug prices, insurance for all, no cuts to Medicare or Medicaid. I regret to say to the Senate today, I have no confidence Mr. Azar will change course at the Department of Health and Human Services. I do not support his nomination, and I urge a no vote today, and I yield the floor.